Hello, my name is Raven Peterson. I'm going to be performing the head, eyes, ears, nose, throat assessment on my patient today. And before I get started, I'm just going to ask my patient for her permission to record this video and post it for a school assignment. Do I have your permission?
Yes.
Great. Okay, to start the assessment, I'm going to just start by inspecting her head and her scalp. And what I'm looking for are any masses, the shape of her head. I'm looking at her hair, the distribution of it, and all of that looks good. And so also I'm looking at her face, I'm looking at the symmetry of everything, even noticing her ears with just the general inspection. And so after that, I'm going to move on to palpating her scalp and her head. And so what I'm doing is just feeling for any lesions, hematomas, depressions, and just figuring out if she has any sore areas. Did any of that hurt?
No.
Wonderful. And again, her hair is nice and well distributed across her scalp, no signs of alopecia. So after the inspection of the head, I'm going to move on to the eyes, and I'm going to start just with inspection of the eyes. And what I'm looking at is her sclera and her iris. And with the sclera, could you open your eyes for me and look at me? Thank you. I'm noticing that they're nice and white with nice blood vessels running through them, no redness. In her irises, both have nice color to them. Next, I'm going to look at her conjunctiva and just looking at the color, and I'm seeing that they're pink and white towards the bottom. No signs of infection, which is good. And while I was doing that, I was also looking at her lacrimal ducts, and her eyes are are moist throughout, and I didn't see any swelling around her lacrimal ducts, and so I don't have any suspicion of an obstruction in those ducts. So next with the eyes, I'm going to check for her acuity, which is cranial nerve number 2, the optic nerve. And so with visual acuity, I have a 6-foot Snellen chart. And so I'm going to start just by having her cover one of her eyes. I'm going to be 6 feet away from her, and I'm going to ask her to read the lowest line she can read.
LTFPH.
Great, and that was 20/20, and I'm going to have her close the opposite eye. I'm going to give her a couple seconds for her eye to focus again. And then I'll hold the chart back up and have her read the lowest line she can read for me.
LTFPH.
Great. So both of her eyes are 20/20, meaning she can see at 20 feet. She has regular vision at 20 feet. Next with the eyes, I am going to check her pupil reflexes to light. And so with this, I am going to shine the light in one of her eyes, and I'm watching them constrict and dilate, and then I'm going to shine it into that same eye again, and I'm watching the opposite eye constrict and dilate as well, which is consensual. And then next, I'm going to do it to the opposite eye. Again, I'm going to do it twice. Keep looking right at me. And both eyes constricted and dilated to 2 and 4 on the dilation. So after that, I'm going to have check her extraocular eye movement, which is cranial nerves number 3, 4, and 6, trochlear, oculomotor, and abducens. And with this, I'm just going to have her look at the light, and I'm going to have her follow it with both eyes. Great. And with that movement, I was checking for any nystagmus or twitch in the eye when she was following that light. And next I'm going to check for accommodation. And so with accommodation, I'm going to have her stare at this light here. And then I'm going to have her refocus on something far away. And so stare at this here. Now look at the wall back there. Great. And that is accommodation. So at the close object, her eyes constricted, and at the far object, her eyes dilated. Next, I'm going to check for convergence, and so I'm going to have her look at the light, and while she's looking at the light, I'm just going to move it closer to her face, and what's going to happen is her eyes are going to move independently in opposite directions. Well, at least they should. So I'm going to have you look at this light. Great, her eyes converged, and again, no signs of a nystagmus. So next, I am going to be looking into her eyes, looking for the optic disc, optic cup, and her veins in her eyes. I'm also going to be looking for the red light reflex. And unfortunately, I left my ophthalmoscope at immersion, and so I'll just be using this tendon reflex to demonstrate what I would be doing had I had my instruments. So I'm going to be at a 15-degree angle approximately, and to start this, I'm going to have her just look right beyond my ear here for me, and I will be looking with my right eye into her right eye, and I will put my instrument to my eye first, and closing this eye, and then shining the light into her eye, and looking for the red light reflex. And when I get that red light reflex, I'm going to approach her closely with about 3 fingers out, just to protect the patient while I'm doing this, because you do have to get close to them. And so when I'm approaching that red light reflex, when I get in close, I can make some adjustments until I see that optic cup and the optic disc. The optic disc is a yellowish circle in the back of the eye, and the optic cup is a more white circle that lies in the optic cup or the optic disc. And the ratio of the optic cup or disc to cup is 1 to 3. So the cup should be approximately 1/3 the size of the disc, and if it is larger than that, we'd be worried about cupping. And when I'm looking in the eye, I'm also looking at the veins and the arteries in there. The veins should be larger than the arteries, and I'm looking for any nicking or cotton wool spotting, which I didn't see any of that. And I'm going to do the same on this side, at a 15-degree angle, left to left. I'm going to get the red light reflex, approach, find the optic disc and the optic cup, and then also examine her veins and arteries in the eye. So that concludes the eye examination. Next, I will move on to the ears. So with the ears, get your hair out of the way. Starting just by inspecting them, looking for any drainage. I don't see any. So what I'm going to do next is, I'll just start by palpating the ear. And when I'm palpating, I'm feeling the tragus and looking for the folds of the ear, especially that's mostly important in newborns, making sure they have nice folds in their ears. But she does, and when I'm palpating the ear, I'm asking, does that hurt at all?
Yes.
Okay, so she does have pain in this right ear, which is why she's being seen today. And for the inspection and palpation, I'm just going to be doing that on both sides. Does that hurt?
No.
No, so that ear does not hurt. Again, I do not have my otoscope. I will just be using my tendon reflex instrument in place of it. And so now that I know that this ear is sore, I just want to be really careful in inserting the instrument into her ear. And for a kid, I will want to, probably her age, about 10 years old, pulling down and back to get the best view of the internal ear canal. And so looking at the ear, just again, having these fingers out for patient safety, I'm visualizing the external ear canal, and then I'm visualizing the tympanic membrane. And with her, she came in with ear pain. I am seeing redness and swelling in her around her tympanic membrane and slightly up her external ear canal. I'm also looking at cone of light. In her right ear, it should be at approximately 7 and 8 o'clock. And then her left ear, the cone of light will be approximately 4 to 5 o'clock. And so I'll be again inspecting this ear, pulling down and back, visualizing the external ear canal. On this ear, there are no signs of swelling, redness, or irritation. I visualized her tympanic membrane, which was gray, shiny, pearly in color. And that is that for the ear inspection. Next, I will do a couple hearing tests on her. So for the hearing test, the first one I'm going to do is just have her cover one ear, and I will whisper a word onto the opposite side, and I'll have her repeat that word for me. So Alicia, if you cover your left ear and tell me what I say.
Apple.
Good. Now cover the other ear.
Baseball.
Baseball. So her hearing acuity is good on both ears. The next test I will be doing is the Weber test, which I will be using the tuning fork for. And on the Weber test, I'm just going to strike the tuning fork on my hand, and then I will place it on the top of her head here. And what I'm going to be doing, say you can hear it equally on both sides. What I'm going to be doing is asking her if she can hear it on one side better than the other, or if she can hear it equally on both sides. Could you hear it better in one ear or equally on both sides?
Equal on both sides.
Good. And so the next test and that is just checking for any unilateral hearing deficits, and she did not show any signs of that. So the next test I'm going to be doing is the RIN test. For the RIN test, I'm going to be striking the tuning fork and then placing it on her mastoid bone behind her ear. And I'm going to tell her to tell me when she can't hear it anymore.
Okay.
Can you hear it now?
Yes.
Okay. And so after she said she couldn't hear it on her mastoid bone, I put it next to her ear, and she could hear it again. And what that means is that the bone conduction is less than air conduction, or air conduction greater than bone conduction. AC is greater than BC. And I will do that same thing on the left side. Okay, tell me when.
Okay.
Can you hear it now?
Yes.
Wonderful. And so that is testing for cranial nerve number 8, and that is intact. So after that concludes the ear inspection, next what I'm going to do is I'm going to move on to the nose inspection. And for that, I'm just going to start by visualizing the nose, I'm looking for it to be midline. I'm just kind of looking for her septum to make sure there's no deviation there. And next I'm going to go ahead and look inside her nose. And again, what I'm doing, I'm just looking for the color. I'm looking for any obstructions, and then I'm looking for any deviation of the septum. And her color is pink. It's moist in there, no polyps. And so after that, I will test her airways. And to do that, I'm just going to occlude one nostril and have her breathe in and out the other. Any problems?
No.
Good. So she has good patent airways in her nose. Next, I'm going to have her do a smell test, which I have vanilla for. And so I'll open it slightly. It's very smelly. And so I'm going to just close one nostril and I'll have her smell. Do you smell that?
Yes.
Good. You smell that?
Yes.
Good. So her smelling is intact, which is cranial nerve number 1, olfactory. And again, palpating the nose, seeing if it's tender. Did that hurt at all?
No.
Good. So that concludes the nose assessment. What I'm going to do next is move on to the mouth. And for the mouth, I'm going to start just by inspecting her lips. I'm looking at the color, shape. I'm looking for any sores, lesions, any swelling. And she has, her lips are moist. They have nice color. I don't see any lesions or sores. So after I look at her lips, I'm going to have her open her mouth. And looking at her mouth, I'm going to start by looking at her tonsils. Open wider. And her tonsils are present in both sides, +2. No white spotting on them. No redness or swelling. When I'm at the same time, I'm visualizing her uvula and her soft palate and her pharynx. Stick your tongue out a little bit. Okay, now say ah. Good. And so when she says ah, her uvula moved up, and just the fact that she can say ah and she is speaking to me clearly means her cranial nerve number 9 and 10 are intact. Glossal pharyngeal being the 9th and vulvar being the 10th. So again, I'm going to have her open her mouth, and next I'm just looking at open wider, show me your teeth. So I'm looking at her teeth, I'm looking at her gums, I'm looking for the color of her gingiva, I'm looking for any hypertrophy or swelling or signs of infection, and then her teeth, I'm looking for any abnormal growths, and also signs of infection, which I don't see. And then next I'm going to have you open your mouth one more time. Now stick out your tongue. Move it to this back and forth. Good. And so being that she can move her tongue back and forth with no problems, her cranial nerve number 12, hypoglossal, is intact. So that concludes the mouth assessment. Oh, and lastly, I'm looking at the color of her tongue itself. I'm looking at the papilla. They are well distributed, approximately a centimeter each. Also good. So that is the end. Oh, and I'm also looking at her. Stick your tongue up for me. Her up in the air, that way. Yeah, let me see the bottom of your tongue. Good, I'm looking at her salivary glands. She is producing saliva. underneath her tongue. So that is the end of the mouth assessment. What I'm going to do next is move on to the neck assessment. And for the neck assessment, I'm going to start just by inspection again. I'm going to be looking at her trachea, which is midline, no deviation. I'm just glancing at her thyroid, looking for any enlargement, which I don't see. So after that, I'm going to have her move her head side to side, just checking her range of motion in her neck. So go side to side like this. Good. Now flex your neck and extend your neck. Good. Now turn your head side to side. Good. Now turn your head against this, push against my hand. Good. Good. Now shrug your shoulders up and down for me. Good. So cranial nerve number 11, her accessory muscle is intact. After the range of motion in her neck, I'm just going to inspect her thyroid, and I'm going to inspect it from the front, and I'm also going to have her turn her head and get a lateral view. Good. And I'm going to have her swallow. Good. And I'm just, again, visualizing her thyroid right there. What I'm going to do after that is just come behind her, and I'm going to palpate the thyroid. Just feeling for any enlargement, any lumps or bumps. I'm going to have her swallow again. Good. Okay. So after the neck assessment, I'm going to check for I'm going to be checking her lymph nodes. And what I'm looking for on the lymph nodes is just any swelling, any masses, and what I'm really paying attention for is a hard nodule that does not move. And so with her lymph nodes, I'm going to start with her pre-auricular, post-auricular, occipital, and go submandibular, then submental. And I'm just lightly palpating with my middle 3 fingers. And then I'm going to palpate posterior cervical chain, palpate the anterior cervical chain, and then supraclavicular. Excellent. And on her lymph nodes, I did not notice any masses. And that concludes my head, eyes, ear, nose, and throat assessment.